Welcome to the Henry Foreman Atkinson Dental Museum here in the Royal Dental Hospital of Melbourne and the Melbourne Dental School. A great trace back through history of innovation around oral health, dentistry, advances in care and prevention. And a great place for me to meet two leading lights of innovation in the school. Our predecessor as head of school, Professor Reynolds, whose research has led to some groundbreaking elements of dental care, and Professor Julie Satur, who will talk to me a little bit about the advent and the growth of the profession of the dental health therapist, something that's driven care in Australia to the new level. And it's a great place that we're in. So we've traced back to the museum here. We can clearly see different step changes throughout the years around education, but around how dentistry has been practiced in Australia and around the world over the last century. And the people I'm going to be talking to this afternoon in this meeting is giving a new insight into how advances of research and care led by Melbourne Dental School reach the wider public and the patient base of Australia, Asia Pacific and the world. It should be a very interesting conversation. Julie, Eric, thanks for talking to me this afternoon in our museum. You've both been great innovators and, dare I say, disruptors in your areas, in your fields, which has allowed you to be successful, allowed these step changes in your areas to move forward. But what's the key to being innovative? What's the key to innovative practice? Julie?
I guess it's seeing a challenge or seeing a problem and trying to understand what some of the solutions might be and addressing them. And sometimes the solutions don't come quickly. Sometimes they're little incremental steps and a bit of a cha-cha sometimes, back and forth, isn't it, to sort of get it right. But it's also probably being brave enough to try.
Okay, brave. I like the concept of that. Eric, what about yourself?
I totally agree with what Julie said, and I think for me it's about passion. You've really got to believe that once you've identified the gap, as Julie said, and maybe come up with a solution, you need to be passionate because it's a long journey. You experience a lot of barriers and hurdles along the way, and that's why you need that passion and that drive to stay committed and self-belief and get over those hurdles. Otherwise, it's too easy to give up.
Eric, it's all about innovation and about step changes, and your research, certainly over the last 30 years, has transformed dental care through the commercialisation and the creation of the product called Recaldent. Can you give us some indication of how that came about and this journey from the research you were doing in the lab to this global product that now is being used?
Thanks, Alastair. Well, it all started in the 80s, believe it or not, with research funding we had from the Victorian dairy industry. And I was really interested to see whether milk could remineralise early stages of tooth decay. And I was also working on saliva, which of course there was some evidence that saliva could do that. And it was interesting when I looked into it biochemically that there's a phosphoprotein in milk that's very similar to one in saliva, stathin. And at the same time though, I had funding from the National Health and Medical Research Council where I was trying to understand the mechanism of fluoride. And what I found was fluoride was very reactive and would end up all on the surface of enamel, and not much got deep into the lesion. And really the breakthrough was combining the phosphopeptide calcium phosphate technology from milk, which is Recaldent, with the fluoride. And then the fluoride incorporated into electroneutral nanocomplexes, which then diffused deep into the lesion. So we got fluoride, calcium and phosphate deep in the lesion to form fluorapatite, the superior form of mineral, so to restore structural integrity. And really, I was a typical academic at the time. I would have just published it. But I had really good advice, and there was a senior professor in the school. And when I presented at one of the school meetings, he said, you should look at patenting this. And he introduced me to people at the university with that expertise, and they said yes. And so the university patented that technology. And it was really the start of what's now called minimum intervention dentistry. Back then in the 80s, it was still GV black, extension for prevention. You saw a little bit of caries, you cut it out, and a bit of the sound enamel as well in case you didn't get it all. A little bit like cutting out cancer. But at that stage, you can reverse the process without destroying the tooth. And so we had a number of companies interested, and now we've got a few partners, and now that technology's in oral care and professional products are in over 50 countries worldwide, and that's really happened. And now, of course, it's it's global. MI dentistry is global,
and it is a step change, an innovative step change in dental practice and concepts around minimum invasive dentistry, as you say, and also vital pulp therapy, where you do as little damage as possible to the sound tissue and try and allow the tissue to repair or regenerate. How's your relationship developed, though, over time with the companies that you've been involved with? Because it is a very different approach as an academic to have that commercial view where you've got an academic commercial partnership.
Well, that's a really good question. Because it was a phospholipid, a biological substance, it really was very new to the oral care industry. So I had to get a company interested to manufacture it. And because it was from milk, I went to a dairy company, and I was really lucky that there was a Victorian dairy company at the time that saw this as an opportunity. We've been involved in every step, with the manufacture, with the global companies making the dental and oral care products, the clinical trialling, even been involved in regulatory applications and even promoting to the profession so they could understand it, because it was very new technology. And talking about phospholipid nanocomplexes, you understand it, but a lot of people don't. You've got to explain what that means and how you can use it.
And obviously, you mentioned there the clinical trials that you undertook and that you led as part of that long developmental process, and the engagement with the profession. How do you engage with the profession for them to understand how this could be beneficial to their treatment planning and their care?
So again, it really, it's about partnering with the right people. And we were fortunate that we went with global companies that are very experienced with engaging with the dental profession. So for the dental professional products, they would get me to go to dental professional meetings and others to present this at research meetings and professional meetings. And dentists, as you know, like new technology and the innovation of it, and they'll try it. But quite often you get, initial adoption and then it dies. I found finding someone in the company who then becomes the champion for the technology, and you work with that person, because that person has got good communication lines in the company, because, as you know, to develop technology from laboratory bench, it's a commercial product, requires an enormous investment. But I still think the original creator needs to be a champion and be involved in all steps, because there were so many challenges along the way, But we've been very fortunate that, this was first launched 20 years ago, and it's still being used today, and globally it's expanded. So it is really getting the right partners so they know the process. I've really enjoyed the path dealing with the companies, seeing the products, seeing the clinical trials, being involved, and actually seeing there's a health benefit. And so that journey to develop something and know that you've spent your career developing that and it's being used around the world is really fulfilling.
Well, that's fantastic, Eric. And I think one of the things that I think we're most proud of is that Melbourne Dental School and your work over that 30-year journey has led to a direct innovative step change in terms of treatment of dental disease and dental caries and decay. And it keeps advancing to this day. And that's tagged to yourself and, of course, to Melbourne Dental School. And thank you very much for your time.
Thank you.
Julie, thanks for joining me in our dental museum, which is, of course, a real trawl back through the centuries of dental care and prevention and innovation in our profession in Victoria and beyond. One of the key things I want to talk to you about today really has been, it's now over 50 years, and certainly 50 years in Victoria, since the real advent and growth of the oral health therapist. And I think that's something we should be celebrating, because it has made a step change in care. But how did that come about? How do we get this career pathway now for oral health therapists?
It's a really cool story, Alastair. You'll know that the school dental program and the school dental nurse originated from New Zealand during the late part of the First World War, where there was a recognition that children's oral health was so poor that it created poor oral health in adults. And they established this world-leading school dental program staffed by what were called school dental nurses. Now, Australia sent a number of delegations to New Zealand, like the rest of the world did, to look at this program. And it faced some opposition over the years. But finally, in the early 1960s, I think 1964, the NHMRC published a report recommending that Australia should adopt a school dental service staffed by a school dental therapist, which was a little bit of a new term. Our dental therapy school opened in 1976 with its first intake, graduating the first group of dental therapists at the end of 1977. So our school dental service was staffed by some young women who were sent to New Zealand, and women is the operative word.
Okay.
Males were not allowed to be dental therapists, and those young women were the first employed, and then the new graduates went out and filled these brand new dental clinics and brand new mobile services. And the ambition was that every child in Victoria, and indeed in Australia, would have free school dental services. But there was also a role in dental health education, so improving knowledge in the community around prevention.
And that's really important.
Yeah.
I think driving that education to school children is critical. How was that done? What was the role played by the therapist? How did you engage with school children, and how now do our health therapy students that graduate do that as part of their program?
Yeah, it's slightly different. The model then was that we would go into each classroom as part of the curriculum and provide dental health education because we were situated in schools.
But of course, we've seen here in our own school here the growth of our Bachelor of Oral Health therapy program with intakes of very enthusiastic students that then go out and deliver care. How has that program evolved over time? Because you have really developed that program and led this profession within Melbourne Dental School, within Victoria.
That's a really interesting question. My driving passion has been to see oral health therapists work horizontally across the health system as well as vertically within dentistry. So connecting the underserved populations with mainstream dentistry and providing services that increase access to care. So we worked over many years to put students into high needs communities that couldn't get access to care and didn't have access to information and support for their oral health. So low income areas, Aboriginal communities, we sent students out with the flying doctor services, the flying dental services into rural areas. Lots of schools with kids with disabilities and hearing issues, the School for the Deaf and so on, and new migrant communities, working with maternal and child health nurses, working with speech pathologists, kids with autism. I mean, the list goes on and on. But for me, it was really important to make sure that our students had exposure to those communities and understood the social determinants of health that created poor oral health, and were able to work with those systemic issues rather than just tell people off for drinking Coca-Cola.
Absolutely, and that is really the key aspect of prevention. If you understand those determinants and look at prevention of disease, not simply treating disease that's present there already. So as the profession has grown, for those that don't know much about the difference between a dentist and an oral health therapist, what is that difference, and what legislation had to happen to allow this growth of this very, very specific but very, very important profession?
I describe dental therapists and dental hygienists, the oral health professions, as complementary to dentistry. They do a range of clinical things. They do checkups, they can take x-rays, they can prevent disease, they do a range of things that a dentist does, but not everything a dentist does. And the things that they do differently is really focus on prevention and health promotion and behaviours around health. So while there's some overlap in the things that they do, they really do specialise in working with people, and I see this profession as the working part of the public health dentistry area that meets the needs of underserved populations.
What's the challenge, do you think, for the profession and for our graduates that we're graduating year on year into this world? What's their biggest challenge that they face, do you think, over the next 2 or 3 years?
The challenges that they face now is that we still have 40% of our population that don't get access to care. We have an ageing population, and we have a sugar industry that profits enormously and drives consumption of sugar that grows dental diseases out of hand. We also have lots of stuff going on in those underserved communities around other chronic disease that interacts with dental disease, that, you know, both of them make each other worse. We can't get enough workforce into rural communities to meet the needs of those communities. We can't get enough workforce into Aboriginal and Torres Strait Islander communities. We should be having a hygienist or an oral health therapist in every residential aged care and residential disability care setting we have in Australia. So more to do than we've got hours in the day.
I absolutely agree, and I think you've hit the nail right on the head that we have significant challenges that we can lead on, but actually those challenges are putting our therapists along with broader healthcare teams in aged care settings in rural communities. Those are big important challenges that are facing us right now, that we as a university, we as a school, with the quality of the students that come and join us, and the quality of the graduates that we put out, and with our staff leading that, can address those problems. Julie, Eric, how do we inspire innovation in our students, from our BOH undergraduates through to our PhD students that may come in post-degree? Eric?
Yeah, so it's important to get them involved in research early and get them excited about the research, and then I think that leads to innovation, and very important to mentor them as well, so they understand the path and the journey that they can take their ideas through to ultimately commercialisation, if that's the journey they want to go on. As soon as you get that inkling that the student, PhD student, is interested in an academic career or actually taking their work further for innovation, is get advice to them about how they can take their ideas further.
Absolutely.
But it's all about capturing, you know, that excitement, so they get bitten by the bug that bit us.
I think exposing students to the broadest gamut of experiences we can while they're students, but it's a good approach to education that encourages students to take risks, exposes them to lots of experiences, even the ones they think they don't like, and engages them in conversations about those questions. You know, what could work better? How could we do this better? What is the biggest thing that's going on here that we might need to find a solution to? And you've done that brilliantly over the years. So I think both of us have the same ideas, we just have taken them in different directions.
And certainly your vision and the work that you're now working on in terms of placements for our students, and challenging placements and environments, and what we can do, we've got examples of it with our students on the walls in the museum here, I think really could take our students into those very interesting places where you can inspire, which would be fantastic.
Yeah.
But I think as a school that is inspirational, my view would be we want to keep mentoring and driving our students in that direction, because we have a history of being inspirational and being innovative. Thank you both for your time today and joining me in the museum. I really appreciate it.
Thank you.
Thanks.